Is there a motion?
I would move to approve the meeting minutes for May 11th, 2021.
Second.
It's been moved and seconded. Call for the vote.
Commissioner Mejia,
Aye.
Commissioner Edwards,
Aye.
Commissioner Minzer.
Aye. That motion carries. Those minutes are approved unanimously. Next, we have two proclamations to address. The first one is a proclamation for Immunization Awareness Month. And I will go straight to Shelley to introduce this proclamation.
Thank you so much. Good afternoon, commissioners. To share more with us about National Immunization Month, which is August every year, and the importance of vaccinations for all ages, we have Gretchen Toller with us today, who is the manager of our Nurse Family Partnership and Maternal Child Health Program at the department, as well as our incident commander for the COVID-19 response, Mark Moffett. Gretchen and Mark will be both speaking to this proclamation today, starting with Gretchen.
Good afternoon. Thank you, commissioners, for recognizing Immunization Awareness Month. As Shelley stated, I'm Gretchen Teller. I'm the Maternal Child Health and Nurse Family Partnership Manager. I want to start by saying that according to the CDC, immunizations continue to be one of the most impactful and cost-effective health interventions that we can provide in public health. For each birth cohort vaccinated against 13 diseases, we save approximately $13.6 billion in direct medical costs, and 42,000 lives are saved a year. Immunization save children's lives and protect future generations. Because of vaccines, our children are protected against more diseases today than ever if we have them vaccinated. There are diseases that once injured and killed thousands of children that are no longer common in the United States. An example of this would be polio. As adults, we can also protect children by keeping our vaccinations up to date. One example is the Tdap, which prevents against pertussis, or what is also known as whooping cough. In an adult, pertussis might look like an annoying, lingering cough, but for a young infant, it can be life-threatening. And these babies are often very sick and hospitalized. Sadly, grandparents and parents can pass this on to their young baby without realizing that they have more than a cough. So I would encourage adults to make sure that they are getting their Tdap booster every 10 years. In fact, if an individual gets vaccinated when they're pregnant with like the flu shot, they can pass these antibodies on to their infant, and they'll be protected for the first couple months. So some local data to share with you, 39% of Thurston County children have received recommended immunizations by their second birthday, in comparison to Washington State, which is 40%. For our 13-year-olds, 24% of Thurston County 13-year-olds were up to date, in comparison to 28% for the state. And our 65-year-olds are doing pretty well at 70% having gotten a flu shot in the last year. So we like that number is a little bit higher. I want to assure people that vaccines are safe. They're carefully reviewed by healthcare professionals, scientists, and doctors. They typically go through many years of careful testing to make sure it's safe and that it works. If parents do have questions about vaccine safety, I would encourage them to talk with their doctor. And as we get ready for back to school, it's a great time to make sure that our children are up to date with immunizations, but also us as adults too. It's time to check in on ours. In the next month, our department will be providing a couple back to school immunization clinics in coordination with the Medical Reserve Corps. And then I want to quickly share my screen to share the schedule and vaccines that are needed for back to school. Can you see that okay? Okay. So you'll see for kindergarten through 6th grade, they need to have 3 doses of hepatitis B, 5 doses of Tdap, and then polio, MMR, and then varicella, which is for chickenpox. And then our 7th grade to 12th grade, also 3 doses of hepatitis B, Tdap, and then the polio, MMR, and varicella as well. If people do have questions about the needed vaccines for school, they can always access information through Department of Health or through our department, Thurston County Public Health and Social Services, or their physician as well. And I will pass it over to Mark.
Good afternoon, Commissioners. I'm Mark Moffitt, the Incident Commander for Thurston County's Incident Management Team in the response to COVID-19. In Thurston County, vaccine providers have administered over 300,000 doses of COVID-19 vaccine. On January 23rd of this year, Public Health and Social Services conducted our very first vaccine clinic. Since that day, we have administered over 53,000 doses through mass vaccination sites, mobile clinics, and in-home vaccination events. And even with those massive efforts, only about 58% of Thurston County residents 12 and older are fully vaccinated against COVID-19. We know that COVID-19 vaccines minimize your risk of getting COVID-19 and decrease your chance of severe illness if you do get sick. Getting vaccinated yourself may also protect people around you, particularly people who are high risk or unable to get vaccinated. Public Health and Social Services is vaccinating our community 7 days a week through mobile vaccination events throughout Thurston County, including our storefront location at Capitol Mall. And this is open noon every day to close at the mall. With the Delta variant on the rise and some of our highest COVID-19 transmission rates in Thurston County happening as we speak, it's more important than ever to get vaccinated. I cannot overstate the importance of getting yourself and your families vaccinated against COVID-19 today. I want to thank this board for your continued support of Public Health and Social Services throughout this pandemic, and also our numerous community partners like United Way, Providence, South Puget Sound Community College, Thurston County Fairgrounds, Capitol Mall, Maxim, Birdseye, our own Medical Reserve Corps, and Medic One, just to name a few. Without those partnerships, none of this would be possible. And I'll give it back to Shelley.
Shelley.
Thank you so much to Mark and Gretchen for that. And we'll ask if the board has any questions before the proclamation.
I have a comment. Yeah, you know, I have a long story with immunizations. When I immigrated from Honduras, I brought my immunization records so I could attend school, and those records weren't enough. So at 11 years old, I had to have all of my immunizations all over again, and it wasn't pleasant. I did not enjoy that, as I do not like shots, but it was something I had to do, and I did it gladly to be able to attend schools. And it was the same thing when the COVID shot became available. I do not like shots, but I felt it was my responsibility to do it to protect, you know, my fellow residents here. So please get vaccinated if you still have not gotten vaccinated.
Anything, Commissioner?
No, I don't have a lengthy discussion at this point. I've got some other issues to bring up later, but the hesitancy on getting the vaccination, I do understand people having their own views and their choice, but I think what we're finding out here is that those folks that do get the vaccination, if they come down with this, they have a much better outcome in the end. And I think that's what we're shooting for. And one of the things, and I'll be bringing this up later, is I'd like to know more about those folks that have come down with it, and even possibly those that have come down with it after they've had the vaccination. Because I think it's important that we keep track of how this thing spreads. Because I really do think that we're all going to get this thing at some point. I believe that. I mean, I can see this thing spreading. I think it's going to be like a lot of other diseases that we deal with. And we ask kids to get shots before they go to school, because I think it's for the benefit of them and everybody else. So I just think it's worth paying attention, educating the public as much as we possibly can. especially when it comes to those folks that are admitted to a medical facility because of this sickness. Many are not going to be admitted, but the more we know about those that are admitted, I think we can get preventative information out. And I don't know, I'll use diabetes just because it's an issue that they talk about that could have an adverse outcome, or asthma or something like that. I think if people would realize that their kids that have that tendency maybe, I think they'd push a little harder. So anyway, we asked earlier today in a work session for the vaccinations, and I'm not going to go over these because heck, I can't pronounce most of them. But the reality is we've been asking people in our communities for a long period of time to get a vaccination shot. And I do think it's worth doing, especially if you fall within the category that you might have an adverse outcome or your loved one might have an adverse outcome. And maybe as a spin-off of that, I think it gives us a lot of incentive. I've wrote 2 articles to the county employees that really focused on incentive to do things to get your overall health better, because you will have a better outcome. Maybe lose weight, maybe get treatment for asthma, maybe for your diabetes. I don't know what your issue is. Everybody has issues. I know I've got plenty. And I do think it's really worth getting vaccinated to help get this thing under control. I know a lot of people are suspicious, a lot of mistrust out there, but I think we're all going to be faced with this at some point in time. So I know I went on longer than I wanted to, but I think it's a worthwhile issue to encourage folks to get on with this.
Thank you. Yeah, I agree with the comments of both my seatmates. Shelley and I, when she proposed this to me, I said, well, hasn't it kind of been immunization year? Like, do we, is there a point of doing this? But she brought up 2 points. One is we still need to work on getting the population with the COVID vaccine, but we've also, prior to that, been working with getting school kids, and there's other, vaccination issues that we were dealing with before this ever, entered our radar. So we felt it was worth taking the time to do this, and I appreciate her sort of convincing me of that. So with that, I'm ready for the proclamation, Commissioner.
Thank you. Proclamation for Immunization Awareness Month. Whereas Immunization Awareness Month highlights the important role vaccines play in preventing serious, sometimes deadly diseases in people of all ages. Whereas immunizations or vaccines contain weakened microbes of infectious disease such as influenza, measles, smallpox, typhoid, and others that, when injected into the body, fuel the production of antibodies that develop immunity to each disease without ever getting the disease. And whereas when people are unvaccinated, outbreaks of diseases like pertussis, whooping cough, and measles can and do return, putting vulnerable people at risk. And whereas an 84% drop in measles deaths occurred worldwide between the years of 2000 and 2016 as a result of measles vaccine, and a rebound of the disease in 2019 with the greatest number of cases in more than 15 years due to unvaccinated persons. And whereas every year approximately 42,000 adults and 300 children in the United States die from vaccine preventable infectious diseases. And whereas diseases are never truly gone and communities must remain over 90% immune to continue being protected. And whereas vaccines are safe and available to allowing our communities to stay healthy and thrive. And whereas COVID-19 disrupted routine child and adult wellness visits over the last year, causing vaccine rates to drop in Thurston County. And whereas our county government promotes immunization awareness along with state and national organizations, such as the World Health Organization and the Center for Disease Control and Prevention, and encourages all people to discuss vaccination with a healthcare provider and to get any needed immunizations. Now, therefore, be it resolved, the Thurston County Board of Health hereby proclaims August as Immunization Awareness Month and encourages all community members to recognize the importance of vaccinations for people of all ages in every community across the country to reflect on the progress of science and medicine and the eradication of contagious disease, and for all residents to do their part to help maintain the health of our community by staying up to date on immunizations. Adopted this 10th day of August 2021, Board of Health.
Thank you, Commissioner. Thank you to our staff members. Gretchen, thank you for being here. Okay, let's go to our second proclamation for this month. It's Overdose Awareness Day. And back to you, Shelley.
I think I will pass it over straight to our Thurston County Opioid Response Coordinator, Katie Strozik, who will present this item. And I know there are also other members of the community in the Thurston County Opioid Task Force that are here today to be present for recognition of this very important upcoming day on August 31st of Overdose Awareness Day. Katie.
Thank you, Shelley, and thank you, commissioners. So the proclamation that you have in front of you really mirrors that August 31st every year is International Overdose Awareness Day. It started back in 2001 in Australia and has been an international event ever since then. It really comes down to a couple key points for Overdose Awareness Day. One is to break the stigma around individuals using drugs and individuals overdosing. Also noting that overdoses are a completely preventable death. From a harm reduction standpoint, by using something like Narcan, overdoses don't have to become fatal. To memorialize those who have had their lives lost by a fatal overdose, and then also to hold space for the grief that family and friends may feel after losing a loved one or who have been present at the scene of an overdose as well. So this proclamation actually ties in with an event that we'll be doing on August 31st. The details for the event are still kind of pending due to COVID. We've, like last year, have had a lot of changes in what we're able to actually plan, but there will be something going on in the community on August 31st, most likely at multiple locations where individuals will be able to come and memorialize individuals in the community, memorialize individuals that they personally know who have had their life lost by an overdose. And then also one thing to note as well is with the county proclamation, City of Lacey, City of Olympia, and City of Tumwater are also all doing their own Overdose Awareness Day proclamations. And it's the first year where that's ever happened, where the county and all three other jurisdictions have done one as well. So that's really exciting. As far as partnerships as well, we did invite a couple people here today for the proclamation specifically. I know not everyone was able to make it, but we invited some of our public health staff who were able to successfully respond to an overdose with Narcan during a COVID testing event downtown. We also invited individuals from ESD 113 for taking the initiative to have their school nurses and other staff trained on how to administer Narcan and respond to an overdose if that were to happen on their campus. We have pretrial services here just because they've been working on being trained to have Narcan on site at their office and distribute it as well. And then the state public defender's office as well, for being a state office who's taken the initiative in being trained on overdose response for their staff were something to happen in their office. And I will kick it back to you then, Shelley.
Thank you. Any questions from the board?
I don't believe I have any questions. I do have I'd like to say something real quickly. If I could.
I don't have questions.
Before I get to Commissioner, any of the guests that Katie referred to, if there's any comments that those folks would like to make, they'd be welcome to provide those. I don't know if there's anybody. Just raise your hand maybe and I'll call on you. Larry.
I'm really proud that you, as the county commissioners, get to take this time to do that, to make this proclamation for all of those who have lost a loved one to overdose. It lets you know that the county commissioners care and that the citizens of Thurston County care about all of us. with great, loss of my son, Jandon. It's great to say his name and to think about one thing that he did was that he didn't care what somebody looked like. At one time he had his own apartment, and it was really hard because he invited everybody over to the apartment, which really made me upset. But one time we were stopped at a stoplight, and he rolled down his window, and there was a person standing there that I never would have invited anywhere. And not only did my son invite him to that apartment, but he invited him he said he also had food. And so that's the type of person that my son was, that he took care of everyone. And that's what this proclamation does. It makes sure that we can take care of everybody and reduce the stigma because he was with people when he was using, and I wish that one of them had Narcan with them so that today could be different and that he could be here talking about people that he loved, that he had lost to overdose. And so I'm just grateful to have this opportunity. Thank you.
Thank you for sharing that. Anybody? Okay. Proclamation. Oh, sorry, Commissioner Edwards.
I would just mention, I didn't know Larry was going to be speaking just now because I'd talked to him before his son had passed away, and I know this is a big issue. But I've been asked, how come I keep this up here? I've had this on my desk for, I don't know, several years now. Kyle Brington's mother brought this in and talked to us a few years ago. And this is about her son and about his death at 31 years old. And I've kept it there, Larry, not knowing you were coming to say anything, but I really do think that we care tremendously here at the county about young people and the problems that they face. And this is just one of them. And I'm hoping the mother won't take any offense, but she left it. And the chair of the board says, anytime we get stuff up here, it becomes part of the public record. And I just think it's been worth keeping this here to remind me every day of how important this topic is. So, Larry, nothing like what you've put up with, but thank you for your comments as well. It's just such an important issue to deal with.
Thank you, Commissioner.
Thank you, Larry, for sharing. And it just, goes to show that we all know someone who's, either going through it with a loved one or a family member. And this is a time when we need to come really together as a community and support and be prepared. So thank you for sharing, Larry. Ready? Yep. Okay. Proclamation for Overdose Awareness Day. Whereas death from drug overdose is preventable, and whereas Thurston County recognizes the purpose of International Overdose Awareness Day is to remember our loved ones, our friends, and community members who have died from overdose. And whereas drug overdose deaths continue to occur in Thurston County and community action is needed. And whereas people who experience an overdose are deserving of our care and kindness. And whereas stigma creates barriers to disclosing drug misuse and abuse to family, friends, healthcare providers, service providers, and others. And whereas when someone you care for dies from a stigmatized behavior, such as overdose, grieving is often much harder for those left behind because of shame and guilt. And whereas Thurston County Opioid Response Task Force Overdose Work Group and numerous community agencies have prioritized innovative strategies to distribute the life-saving medication naloxone in our community to reverse opioid overdoses. And whereas the scientific evidence is clear that substance use disorder is treatable, recovery is possible, surviving an overdose provides an opportunity and hope for the future. And whereas we applaud local residents, outreach workers, school nurses, law enforcement, service providers, and area employees who have been trained to administer naloxone in the event they see an opioid overdose in the community. And now, therefore, be it resolved, the Board of Health hereby proclaims August 31 as Overdose Awareness Day in Thurston County and urges all residents to remember those that have died from an overdose, to become familiar with the signs of an opioid overdose, learn how to administer naloxone, consider carrying naloxone, and visit stopoverdose.org. Adopted this 10th day of August 2021, the Board of Health.
Okay, thank you.
Larry, thank you for being here today. Appreciate it.
And good luck on your new job there that you're doing.
Absolutely. Thank you, Larry. Okay, let's move to item 3, opportunity for the public to address the Board of Health. And we'll go over just the guidelines for the new folks. Board of Health welcomes comments from the public at our meetings. Some guidelines governing such comments to ensure they are appropriate. When you're called, introduce yourself, including the address you reside in the county. Address the board, not audience or staff. Please silence your cell phones. The Board of Health will not respond to public comment directly. Speakers are limited to 4 minutes to address the board. That cannot be donated to any other speaker. The board reserves the right to restrict a person's opportunity to address the meeting for good cause. No comments that are lewd, offensive, inflammatory, hateful, defamatory, or discriminatory in nature. Please be respectful. No outbursts of any kind, commercial comments such as promotion of a for-profit business, or remarks about, I'm not sure this would come up in the Board of Health, but pending land use permits or similar matters that could eventually come before the board on appeal. And finally, all materials provided to the county may be considered public records subject to release upon request pursuant to the Public Records Act. So with that, we've got John Pettit signed up, and then I'll call for any other speakers.
Good afternoon, Board of Health members. Different than the commissioners, you're now Board of Health people here. And I guess what I'm going to talk about is a little bit of my own, and of course what I'm also seeing once again with this Black Lake issue. Okay. I have this big field and used to run lots of horses down in the bottom of my field. I had 22 horses down there at one time. And I decided that I didn't want those horses down there in the field anymore because they poop. They poop. It rains, the water flows into the river, and that makes the river unhealthy for anybody to be in it. Now, I happen to know that all of the commissioners have children. Some are younger than others. But you know, my kids, when they were younger too, and they were swimming, it's surprising how much water they drink. Their mouth is open, any open spots in them. So the idea of swimming with fecal coliform in and all around them and all over them, it's an unacceptable level. Now, I'm bringing this up because the vast majority of issues regarding public health are things that you don't see. Coronavirus, you don't see the virus. It goes inside of you. It takes possession of your body, and every body can react very differently. So while you are in your position, you have to set a standard and say, this is not acceptable. And if you saw somebody pollute your food and then serve it to you, you would probably say that's not acceptable. If you saw somebody polluting the water, it would be unacceptable. It's not unacceptable a year or 2 or 3 years from now when we get a grant to help deal with it. It's something you have to take care of. Now, health matters are not something you put off for 3 years. We didn't put coronavirus off for 3 years. We put it right up front. We deal with it. It's expensive. And maybe you have to find a way to come up with some money. You have money for the stabilization fund. I realize that this is a little bit of a worry, but this is an emergency. It's a big emergency because There's people, whether it's Summit Lake and they're drinking the lake water, or Black Lake, or any of these places that we have people, whether young or old, little babies. If you wouldn't want to drink the water, do you want people to have to be swimming in it? Because if they're swimming in it, they're drinking it. It's happening. And I guess what I'm asking you to do is don't settle for, well, we just have to wait. We just have to accept. You know what, we can put a sign, putting a sign up, why it's a nice thought, a gesture that trying to tell somebody, that's not a level that's an acceptable level. Okay? The acceptable level is if you know there's a problem, you find it. All that is just like a gun being pointed out. You'd take immediate action to stop somebody with a gun that was endangering people. I'm asking you, take immediate action now that you know there's an issue to stop it. Find out really where it is. Do not accept that, well, we don't have it in our budget. We'll have to wait. That's not an acceptable level of management. Thank you.
Okay. Anyone else in the boardroom that wanted to provide public testimony? And you're up. Yes, sir. Yes, sir. This is your chance. This is it.
Okay, good. Well, good afternoon again. My name's Jason Mosbar, and actually I live on Black Lake. I was actually asked to maybe stay a little bit over for this meeting to testify again, and I'm more than happy to do that, especially if it's going to help move the ball down the field a little bit in regards to our situation. So I'm also the president of Black Lake, or Save Black Lake Coalition. We're the nonprofit organization that is on the lake. We have about 4 people that meet quarterly. We work towards a couple things, usually like navigable waterways in Black River, also salmon restoration, ditch maintenance, amongst some other things. But the real reason I showed up today to talk to the commissioners was that we work closely with Black Lake Special District, and a matter of fact, we have our yearly community meetings together each year, and we made an investment this last year as a community out there through Black Lake Special District to apply an alum treatment that's costing about $1.4 million treatment. We've had amazing results due to the treatment. And I'll say, as and I said this earlier, you know, as a father that has 2 kids that are under the age of 4, this is very important to us. But really the reason I'm here is it's sad that we had such a positive impact from the treatment, and now we have an issue with fecal coliform this summer, which has closed the Kennydale Park Beach. We as a community, through Black Lake Special District, has spent another $53,000 to research the source of the coliform. The $53,000 spent told us that most of the coliform was coming from 3 streams, and it all tested and had human DNA. Now these reports I don't have with me. These are reports that Black Lake Special District did through a third party that they paid to do the reports. And I know that they would be more than happy if they haven't already shared them with the department. Anyway, the worst of those streams being near the Black Lake grocery store, reports say that about 2,000 organisms in a sample have been found. Black Lake, this is another reason I'm here, is because Black Lake Special District said that they have contacted and talked with environmental health and trying to offer assistance with maybe a mailing. And they said that they were declined being able to help with that, and also said that we would have to wait for a grant. And if this is true, it's kind of unsettling to me, especially if I've got a family that lives on the lake and my kids are hard to keep out of the water when it's hot, that we couldn't at least get a mailing out to some of the folks. We are a community there. We've stepped up with time and money, our own money, and we're just hoping that Thurston County can be a partner with us and basically help us. So I showed up earlier and I was basically asking for the board in their next budgets to take into account and try to put some money aside or put it into the budget to help us out at Black Lake. So that's what I'm here for today, and thanks again for giving me a few more minutes and letting me stay after.
Can I ask you a question, sir, before you go?
Yes.
When you say the mailing that you were proposing, what was the vision of what that mailing would say?
Something to the effect that we name the stream that it's coming from and the levels that are from the report, and basically that, hey, you might want to look at your systems, have it inspected, or something to that effect.
Systems, you mean septic systems?
Correct. Yeah. And it might be a little bit of an awareness to them that, hey, this is starting to be monitored now, and we could say it's Black Lake Special District is starting to monitor it now. And I do believe that Black Lake Special District has thought about doing a mailing themselves, but they don't want to, get in the way of what the county should do. So that's my understanding.
Thank you.
So, yeah, you bet.
Okay, there's nobody else in the Zoom, so I think we're ready to move on to our first substantive item, which is a Thurston Thrives update. And I see a couple of esteemed gentlemen here to, I think, make that presentation. David Shafford, Doug Ma, welcome.
Yeah, well, thank you. It's so nice to be here in person with all of you. I'm David Shafford, President and CEO of the Thurston County Chamber and its foundation. Want to do a couple things. One, just maybe tee things up or set things up for Doug Ma's more formal presentation. But secondly, I wanted to be here in person to say thank you to the county over these last many months of COVID and your responsibility as the senior health entity within our community. It's been a difficult time, and I wanted just to acknowledge that from the standpoint of the effort that has been put forth by county employees and policymakers and senior staff, and I don't think people get thanked enough. And so I want to make sure my organization, the Thurston County Chamber, thanks you and your efforts over, again, these past many months. So, plus it's just fun to be here in person. So, Thurston Thrives. Just as a reminder, the Thurston Chamber Foundation is the backbone organization for Thurston Thrives, and it's been our pleasure and quite frankly an esteemed honor to work on an initiative and initiatives that support our community's health, individuals' health, people living longer, higher quality lives. There can't be much better than that as far as mission related, and it aligns very directly with the Thurston Chamber's mission of community stewardship. And so we've been very pleased to do that work. One of our key roles as a backbone organization is developing resources to make sure Thurston Thrives has the resources to do what it needs to do in supporting the action teams and supporting direction and its coordinating council. And over the past several years, we've been very pleased that we've been successful in developing the majority of the direct funds to Thurston Thrives and its efforts. And of course, this past year, you've heard that Thurston Thrives is moving to the health equity lens focus. And of course, this is complementary of the county's work and is very much in support and reflective of your March proclamation regarding racism and health. And so that effort has been going on for a year now as far as turning the ship a bit, getting things aligned and in order. There still is much work to be done, and both internally and externally, including making sure that the good and outstanding work of the action teams continues forward in its current state, while we endeavor to attach that health equity lens model to Thurston Thrives. So with that, I would like to turn it over to Doug Ma, who just as, before he jumps up here, one thing we recognized about a year ago is that we were going to need some higher level resources and talents to help assist and facilitate the new direction. And so that's when the Chamber Foundation looked to attain Doug Ma and Associates to help facilitate that on behalf of the Backbone organization. So with that, Doug.
Thank you, David. Commissioners, it's a pleasure to be here again in person. I was getting really tired of being in Zoom, so hopefully I look taller in person than I do on screen. So again, this is our quarterly update. I want to provide you with all the work that Thurston Thrives is doing. And if you go to the next slide, please. There are 5 items that we'll be covering this afternoon. First of all, it's just the general alignment with the work of the county, support for action teams, organizing some new action teams. Want to be updating you on that, continuing to work to identify needs and opportunities and obtaining new resources. So the first thing I want to remind you of, and kind of go backwards a little bit, is what is Thurston Thrives? And so on the next slide, Thurston Thrives is a community initiative using a collective impact framework. And what that really means is that we create a network of community partners. We create a platform to leverage and inform regional policies and develop innovative actions to address the community problems, and that we align cross-sector efforts for measurable results, recognizing that no one specific sector is going to move the needle on any one demonstrable community challenge. And so Thurston Thrives has successfully created a network. We've informed regional policies, and I believe that we're bringing together people and entities to create innovative actions to address some of our most pressing needs. And then finally, we let's see, we already did that. We align our cross-sector efforts for measurable results. So it is a collective impact and uses collective impact framework. So collective impact has 5 characteristics, and it's always important to remember what those 5 characteristics are. It's a common agenda, shared or common measures, mutually reinforcing activities, continuous communication, as well as a backbone organization to bring everyone together, to serve as that facilitator, to really ensure and enable that cross-sector effort around measurable results. And so there, you can use the collective impact model for almost any sort of social effort. But here in Thurston County, we have used Thurston Thrives as a public health initiative using collective impact, recognizing to improve the health of everyone, it's going to take multiple sectors, multiple organizations, all working in concert with an eye toward the larger goal. So one of the things you'll remember is back in December, the Board of County Commissioners amended the comprehensive plan. Chapter 11 was amended and included in the 2020 update around critical issues. There is an additional, 4 additional issues identified, including one that reads, commit to, this is a critical issue, commit to achieve health equity and a course of action that reduces and ultimately eliminates health disparities so that optimal health for all is possible and that differences in life and health outcomes cannot be predicted on the basis of race. So included in your comprehensive plan, you have amended it to specifically state that. In addition, the comp plan refers to some key facts, and in 2020, it was noted a key fact that health outcomes are worse for the Thurston County BIPOC population compared to white residents. So one of the things we did was realign our mission so that Thurston Thrives works to eliminate health disparities so that optimal health for all is possible. Again, creating an alignment between the work of Thurston Thrives, the community health initiative, with your own comprehensive plan. In addition, as you all are aware, in 2021, not only did you pass a proclamation, a resolution declaring racism a crisis, you also passed a proclamation in your role as Board of County Health, proclaiming racism as a public health crisis. So the other thing we did was amend and focus on a single priority to close the health equity gaps between BIPOC and white residents in Thurston County. Should sound pretty familiar now that we have not only linked the work of Thurston Thrives back to your resolutions and your proclamation, but also to the comprehensive plan. So the work of Thurston Thrives is now moving into alignment with your own comprehensive plan and your stated goal for the community, your state, and how you plan for the future. Now, we also, along the way, reviewed data. And I have to say, I'm a big fan of public health and social services. You have incredible people that understand data, that are able to pull together the health metrics that I think we need in order to move the needle or ball or whatever analogy you want to use forward in the area of public health. And so we looked at data, and also the data revealed to us that there are racial disparities, meaning that there are measurable differences between groups of people created by societal barriers and systemic exclusion from opportunities. The data also showed that there are racial inequities and that we are not achieving the highest level of health and well-being for all people. So we moved forward and identified 4 measures of success for the community to gauge how well we are moving forward on improving the overall health of the community and reducing the disparities between the races as measured and looked at via the health data. Again, you'll recall, collective impact has us working in concert, a shared agenda, which I would argue is part of what the comprehensive plan, it creates a shared agenda for us to move forward on, but it also requires us to have some common measures so that we can gauge our level of success. And so we identified 4 measures, including infant mortality, premature births, depression in 8th graders, and fair or poor health outcomes as reported by adults. And you'll see as you quickly go through some of these that you'll note that there are disparities in the data between Black, Indigenous, and white residents here in Thurston County, not only for infant mortality, but also premature births, again, experiencing depression, and the fair or poor health as reported by Thurston County. So the important thing about selecting data, and I think this is really mindful for us, because I know that you receive a lot of information, a lot of data, and a lot of people have a lot of ideas about how to measure something. But the important thing about good data analytics is that the data itself needs to be reported in a timely fashion. It needs to be valid. It needs to be reliable. And for our purposes, to engage the community, it needs to be relatable. And so we believe that the 4 measures that we've identified as indicators, again, there's lots of information that tells us how well we're doing as a community, but these 4 measures as an indicator of overall public health and specifically reducing the disparities between the races and health outcomes meet all of those criteria. And the bottom line is that they are known data sources. They are shared across disciplines and organizations. They have common definitions. When you go from one community to another community, these measures are understood by professionals, and they're also relatable and understood, I believe, by average individuals. So as we move forward, one of the questions we've been asking ourselves at Thurston Thrives meetings is around this ongoing framework that I'll be honest, I borrowed from South Puget Sound Community College in terms of the framework by which they are addressing equity at the community college. But primarily we're asking ourselves, what does the phrase, "we center the people we serve and meet them where they are," mean to us as we look at improving overall health? And to what extent are we involving those most impacted when seeking solutions or making decisions? And how would this influence our health outcomes? We're asking ourselves, what do we need in order to serve and meet people where they are, continually to identify and remove barriers and involve those most impacted? Those are the questions that Thurston Thrives and the Coordinating Council needs to be able to address in order to make meaningful gains in eliminating the disparities between the races on health outcomes and overall move and improve the overall health of the community. So in summary, looking at the 5 items that I wanted to make sure I covered with you, is that I believe that we have reorganized around the county's actions, around your comprehensive plan and your proclamation and your resolutions. We continue to provide support to the action teams. The housing action team is probably the one that you are most familiar with because they are the most engaged and have, quite frankly, the biggest workload of all the action teams given the current, the other crises that we are addressing, which also relates back to overall health. We are actively working to organize new action teams. And one of the exciting things that has come out of this realignment and refocus is re-engaging with the clinical care community. So we are in discussions with Providence, Choice, and Multicare about how they can be engaged and involved in the work of Thurston Thrive, specifically in the area of clinical care. And we, at one time, had a clinical care action team that had since disbanded or disappeared. We are now using this as an opportunity to re-engage with those organizations. I believe in part because their community goals and aspirations are the same as Thurston County's community's goals and aspirations. They recognize that there are disparities in health outcomes by race. They recognize that there's more that they can do to improve the overall health of the community. They want to be involved in this, so we are engaged with them both as supporters, but also as participants in the action teams, primarily in the area of clinical care. We continue to ask ourselves, what do we need, and what opportunities exist for us to leverage and create a better, stronger network in order to move forward. And we're working to obtain additional resources that help to close health equity gaps between BIPOC and white residents. So the work of Thurston Thrives continues. I think we're in good alignment with the county and the expectations you have for the backbone organization as well as the overall community initiative. We're very excited about this work. It gives us focus. It gives us something to strive for and achieve. And again, I believe it aligns well with the overall aspirations and needs of our community to eliminate health, racial disparities in the area of health. And with that, be happy to answer any questions you may have or refer them to David.
Commissioner Edwards.
I don't have any particular questions, but I want to thank you, Mayor, for your past energy in many positions you've held, but now bringing it forward, doing what you're doing today. So thank you very much.
Thank you.
Commissioner.
No questions either, just thank you, Doug.
Great, thank you.
I have a couple of questions. I've been supportive of the kind of narrowed focus of Thurston Thrives. I think that was good, a good step for the group. And I guess I have questions about, are there call them old action teams that are going to be kind of dissolved? I mean, like the 2 action teams that I participated in was the Climate and Clean Action. And we actually, because of the work of the Climate Action Steering Committee and the regional, we've already, we were, irrespective of what you guys were doing, we were talking about should we fold our work there once the jurisdictions adopted the climate mitigation plan. That's just one example. Law and Justice Council is another that I participate in. And that had, a nominal connection to Thurston Thrives. I don't know what other ones are out there that might not fit as well into this new narrowed focus. Is that something that's been dealt with?
It has been discussed and not yet dealt with, in part because I believe all of those action teams can draw a pretty quick logic model to eliminating racial disparities in our community. If even in law and justice, how you administer the jail, you can work to eliminate health disparities. The thing about these measures, I think, is that they are the tip of the iceberg in terms of what we are doing overall in terms of access to care and quality of life. And so even some of the more maybe 2-step removed in terms of climate, environment, it really is not that difficult to make the logic model or to draw the connections around what you are doing and how you can better target specifically around race and ethnicity to improve the overall health of those groups and the overall health of the community. So I think it's something that we need to continue to focus on. The narrowing of the focus around the outcomes and the outputs, I don't believe narrows the overall ability for us to really embrace collective impact. And embracing collective impact means multiple sectors, sometimes a couple steps removed, keeping an eye on the overall objective of a community to solve really difficult problems. So public health is definitely one of those issues that face communities that will benefit from taking a collective impact approach. And a lot of times we do collective impact without actually calling it collective impact. I mean, that's kind of what community building is, right? I mean, you go out there and everybody's kind of doing the same thing and knows when we've succeeded in something. That in itself is collective impact. But I think these other action teams, we do need to make effort to help draw the logic model for them and see and help reveal the place and how they contribute to the more narrow focus, yet still achieving improving overall health for the community.
And then one other question I have is just the goal of identifying barriers to health outcomes, or is there a process plan in place? I mean, how is there like you're working toward a set of recommendations, or you're working toward a report, or like what's the vision for how this is gonna manifest in policy changes or whatever these barriers removals need to look like?
That's a really great question. When you assume that you're dealing with something that is systemic, it is going to be both an examination of your current process, the assumptions that you make, and it's really going to take a variety of approaches. And you are correct, we don't have the plan for eliminating systemic racism in how we deliver or provide access to care in a unbiased or equitable way. And a lot of that is going to be revealed to us as we engage the community and as we do a better and make a better effort of reaching out to those impacted by the services we provide. I think when you look at the service providers and how we deliver service, quite frankly, it is still very much an old school approach. And so the systemic bias and racism that existed decades ago is still in some of those process and procedures and our approaches. So it will take understanding the communities that are impacted and what barriers they see. It will take us reaching out to those groups and individuals and better understanding, and then also embracing the knowledge that they will be passing on to us. So I don't have a plan that says, here's the milestones and here's all the gates, but we are building the capacity so that we can ask these questions and building the capacity so that we as a community can be honest about the answers and then do something about it.
Anything, Commissioner, County Manager?
My microphone is off.
There you go.
So I appreciate the presentation. I think the refocus on racial equity related to health is something that we must do. I don't think that is an optional approach that we have in front of us. So thank you, Doug.
Thank you.
Okay, thanks, Doug.
Great, thank you.
Okay, let's move to the next item. Kind of a good segue here to the 2021-22 Thurston County Opioid Response Plan. And we've got Katie Strozik still with us, our Opioid Response Coordinator. And we've got some revisions and updates to our previous opioid response plan. So Katie, go ahead.
Thank you, Commissioners. Before I get started, there was one thing I forgot to mention during the proclamation, which I know I wanted to pitch. In honor of Overdose Awareness Day on August 31st, we've been making buttons that say naloxone saves lives. I'm going to do my best to show it here on camera and see if it actually works. You can kind of see it without the glare, but it's a box of Narcan or naloxone. It says naloxone saves lives. These are available for anyone in the community. They just need to contact me, and I will make sure that a bunch of them get over to the commissioner's office as well prior to Overdose Awareness Day.
Okay, great.
And then let me pop up my PowerPoint. All right, and can everybody see my slides?
Yes, perfect.
Cool, thank you. So yeah, like mentioned, I'm just going to be going over the Thurston County Opioid Response Plan proposed revisions for 2021 and 2022. So kind of a historic look back. We started with Resolution H1 2018 in June 2018, and that was really the resolution declaring the opioid epidemic a crisis in Thurston County. From that resolution, the task force convened in July 2018, and then the first plan was adopted in June of 2019. And so that's the plan that we have been working off of, that the task force has been working off of up until now. We're asking today for an adoption of the updated plan. So we didn't take the old plan and trash it at all. We actually took the old plan that we've been working on, dissected it piece by piece, looked at what we have momentum on, looked at what work has already been completed, where do we already have funding secured, and then kind of what gaps and barriers we're still missing from that plan that may have arisen over the last couple of years. So the revised plan, similar to the last plan, goes over the same goals that are listed in the resolution. It goes back to healthcare, treatment and support services, overdose prevention, data, innovation and disparities, and then the sixth goal, which the task force added outside of the resolution, which is children, youth, and family exposure. While the new plan is not structured in this way, except for at the end of the document, we've separated it now into kind of action areas to be more easily digested. The proposed plan is broken into these goals at the end of the document, which you received. For the proposed plan for 2021 and 2022, there are 26 proposed total strategies in relation to these 6 goals. And then looking back a little again on the 1920 plan progress, we started that plan with 25 total strategies and 33 SMART objectives related to those strategies. For those of us who are new with SMART objectives are going to be kind of the boots on the ground work and goals that are created for the strategies. So the strategies are high level. And then the SMART objectives are the specific and measurable things that say, in order to do work around this strategy, we're going to do X this amount of times by this date. So we had 33 of those. 19 of those were completed by the end of 2020. 9 of those were dropped. A lot of them that were dropped were due to barriers that existed because of COVID. As we shifted into that pandemic, we had a lot of things that we were planning to do in person, and some of them weren't able to be turned around quick enough to do in a virtual setting or any other kind of means of delivery. And then we continued to work on the other objectives that you don't see listed there in the 19 and the 9. That's work that's been pretty much just continuous, that's also carrying forward into this plan. So when we talk about revising the 1920 plan, this was done from the course of January through July. So it's been a lengthy process and it's had a lot of different avenues of input for it. It was informed by community input and discussions through multiple different sectors. We held strategy discussion groups for criminal justice, treatment, overdose, and pregnant and parenting. All 4 of those topics had 2 90-minute discussion sessions for them. We also have been listening to feedback at work group meetings and then also at larger task force meetings as well. Overall, between January and the end of July, we had participation from 113 individuals, and that's participation across 46 different agencies, both at the local and the state levels. And that's agencies across all different sectors, from social service, treatment providers, government, nonprofits. Everyone was represented for the most part. There were 26 strategies that are in the proposed 2021-2022 plan. That's one more strategy than the 1920 plan, but about the same amount. 14 of those strategies are direct carryovers from the 1920 plan. So essentially we have 14 that we saw in the old plan where there's already funding, there's momentum, there's already work being done, or any of a combo of those. And we just moved them directly over into this plan. There's 12 proposed new strategies. These 12 came out of the responses that we received from the strategy discussion groups and the other avenues mentioned above. A lot of them were just gaps that we found out in the last few years, or areas where we realized, hey, we need more emphasis on this and we need this to be a standalone strategy so that it's not just getting shuffled underneath the other work that we're doing. I mentioned earlier that the proposed plan right now is organized into action areas. These action areas mirror the work groups that are proposed to move forward in. On paper, it makes it really easy because you can look at it, look at a topic area, and then know that a work group is going to work all on that section instead of kind of having to jump around through a document. So the action areas and work groups, we've drilled down to 6 areas. That's going to be prevention, treatment, overdose. Overdose was formerly naloxone for a work group, but it's expanded so we can look at overdose of all types, not just opioid overdoses. Pregnant and parenting, legal system, just formerly looking at criminal justice and expanding it now to legal system because we know that individuals who are involved in the legal system are not always involved on criminal matters. And then equity, which is as a result of the strategy discussion groups which were held, there was an interest in having a work group specific to equity to look at not only racial equity issues, but all other types as well. And then post-plan adoption, whether that's today or a date in the future, the next step will be for the work groups, the 6 that were just mentioned, to take the strategies in the new plan and set SMART objectives. These SMART objectives will be set in September and October, ready to be presented to the task force at the November meeting. And again, those SMART objectives are going to be specific, measurable, achievable, relevant, and time-bound. So the easiest example is you're going to do this activity this number of times by this date. And all of those SMART objectives will have an end date of December 2022 for completion. That is all I have for you today. Do you have any questions?
Commissioner Edwards?
You know, this doesn't have anything to do with your work. Maybe there's litigation going on about it, the whole opioid business. It just seems like there's a lot of folks that have put in a lot of work to get some good accomplishments. And I know there is litigation pending over that, and I don't know how they quantify damages, especially when somebody dies or, you know, the damage to the families or stuff. But if you put a dollar amount or an hour amount to how much time has been put in by so many people and organizations and our own folks, I bet that'd add up to a phenomenal bill, not even coming close to incarceration and treatment and all that type of thing, but to present to John Tunine as he's working towards settling a case, or even with the Attorney General's looking at some type of a settlement. And I suppose you guys didn't look at that at all from a financial perspective, and I wouldn't expect that would be your goal, but I'll bet there's a big dollar amount associated with the commitment that went into this whole process. And I just want to commend you folks on it. And if you came up with a dollar amount, somebody might want to know when they get towards a settlement sometime.
I know that there's plenty of behind the scenes work that is out of my wheelhouse going on the lawsuit that I'm not privy to, but I can say that when you talk about work being done, having just been in Thurston County now for 2 years, the amount in which the task force as well as community partners have accomplished in 2 years is astronomical. The amount of programming that's been implemented, the amount of different resources that have really been amped up, the sheer number of naloxone and overdose education trainings that have come out of public health from the naloxone work group. We've trained so many people in such a short amount of time. The jail having a fantastic medications for opioid use disorder program now, that's a result of the really great work that the task force has put in. So I really just want to also commend the efforts of everyone who's involved with any of the task force work, because we've done so much, but there's still so much left to do as well, because like Commissioner Edwards is saying, it's a huge thing to work on.
Anyway, thank you very much.
Mejia?
I do have a couple questions. And one, it's in the trainings that you offer, are those trainings, I mean, are they free for the community members? How can people access those trainings?
Yeah, so we have a couple different mechanisms for that. We do workplace naloxone training. So if a workplace is interested in it, they can contact our office primarily through Marianne. And then we'll get them scheduled with one of our couple trainers, and we can do it either Zoom or in person and train their staff, and then provide them with naloxone kits to have on site. Previously, we were hosting about once a month community sessions just for the general public to be held on Zoom. But with scheduling and COVID and things, those stopped being once a month, but we're looking at also still holding community sessions as well for the broader community to engage in training. Also, at any time, anyone can access naloxone through our syringe services program as well on Tuesdays and Thursdays from 12 to 5 at the 1000 Cherry Street location, and they can train you on site as well there.
Has there, thank you for that. Has there been any discussion about maybe an impact due to the Blake decision? I mean, has that been discussed in the work group?
Definitely. The Blake decision was ironically right around the time of those two big strategy discussion groups that were held around criminal justice. And of course, when looking at the former plan and how we translate it to the revised plan, Blake is a huge thing. Luckily, we've had a lot of groups that have already been in conversation for a while now about how to move things upstream and how to not focus so much as to how to arrest someone out of something. But I think that Blake really is going to give us an opportunity to do really innovative things that we wouldn't have had a chance to do before, with that still really being an unknown as the legislature shakes down how money will work and how different systems will work. But it gives us an opportunity to look even further upstream and look at harm reduction models instead of only focusing our intervention once someone has been handcuffed.
Thank you.
Okay, I don't have anything. That was a good question about that on Blake. So what do you need from the board, Katie?
The action item would be to adopt the revised 2021-2022 response plan, which would then move forward to the task force for work on SMART objectives and moving that forward.
And I do see a proposed motion. Do you have that hand?
The action right here? Or it's on the agenda? Okay. Okay, so I'll make a motion. I would move to adopt the Thurston County Opioid Response Plan 2021-2022 and send it forward to the Thurston County Opioid Response Task Force for implementation.
Second.
It's been moved and seconded. Any further discussion?
No, sir.
Call for the vote.
Commissioner Mejia?
Aye.
Commissioner Edwards?
Aye.
Commissioner Minzer?
Aye. That motion carries. Plan adopted. Update adopted. Thank you, Katie.
Thank you, Commissioners.
Let's go to item 6, which is 2020 Integrated Pest Management Report. And Patrick Soderberg from our Environmental Health Department, Hazardous Waste Specialist, is with us. Pass the baton to you, Patrick.
Good afternoon, commissioners and members of the Board of Health. Thank you for letting me present today. Because we only present on our integrated pest management policy once a year, I'd like to start by just giving a brief overview of the policy and the processes involved, and then we can get to the two issues that we're bringing forth today regarding the policy. So the IPM policy, or integrated pest management policy, was initially adopted in 1989 and then revised in 1991 and again in 2014. The goal of the IPM policy is to minimize the use of pesticides whenever possible. The policy applies to county departments and our contractors that apply any pesticide to an insect, animal, or vegetation problem. The departments begin the process by initially writing an integrated pest management program that details all of the pest or vegetation problems they expect to control, and each of those and how they intend to control them. And those programs were initially approved by the Board of County Commissioners. And then each year, each department writes an annual report that summarizes that year's activity. And then there's a citizen advisory committee of volunteers that review that annual policy or annual report every year, and then report back to the Board of Health on the progress that the county is making. Within each of the programs, the county departments develop what are called prescriptions, which is basically the process in which they use to evaluate a pest problem, and then the control measures, both non-chemical and chemical, that they propose to use. When they propose chemical controls, a specific pesticide will be listed in that prescription. And then the Environmental Health Division has a process where they evaluate each one of those chemicals, and they look for the hazards that the IPM or the policy states are unacceptable. Some of those include carcinogenicity, mutagenicity, reproductive toxicity, developmental toxicity. So the chemical reviews try to identify if those pesticides contain any of those hazards. And if they do, they get ranked either high hazard, moderate hazard, or low hazard. And sometimes they'll get a conditional rating, which means that depending on the concentration that's used or where it's applied, may either represent a low hazard, moderate, or high hazard. The Pest and Vegetation Advisory Committee then reports to the Board of Health, and they make recommendations on two things: the progress of the annual reports and how the county's doing following the policy, and then recommendations to adopt or reject prescriptions when they're evaluated and when they work with the departments to try to incorporate all the policy protocols. So today, what we're doing is we're going to start with a review of the 2020 annual report by the Pest and Vegetation Advisory Committee and their recommendation to the board. So they've read the annual report. If you can go to the next slide, Art. And they had some concerns over the increasing of use of pesticides over the last 4 years. So their recommendation, next slide, Art. So what they're proposing is lake management is very unique in that when we try to control aquatic vegetation so that the lakes are able to be used for recreation and boating, what they have to do is manage native weeds. And that in and of itself is somewhat contrary to the IPM policy that states that we're supposed to be disruptive or least disruptive to the natural system, have minimal impact to the system, and produce permanent reduction. So one of the recommendations that the committee would like is, instead of having to review the implementation of the policy for these lakes programs, is if they could instead review a long-range management plan for the lakes that we manage, which would be Long Lake and Lake Lawrence. That way, what they can do is report back to the board each year on the progress towards the management plan, as opposed to just the policy. So the committee recommends that the county develop a long-range management plan for the lakes that we manage, and that those be approved by the Board of County Commissioners, just like the original program documents were. And then that way, each year, the committee will review what the lakes program does, and then report back to the Board of Health on their progress towards those goals in their plan. And this is very much like the recommendation that was made for Glacial Heritage Preserve. And they created a long-range management plan, and the advisory committee for the last 3 or 4 years has just reported on the successes of the management of preserve with regard to that plan. So it's been working pretty well. Next slide. So all of this information about our IPM policy, if you just go on Google, you can type in Thurston County IPM, and that will bring you to the next slide, where we have all of our reports and processes, because it is a complicated system, that you can review the reports, you can look at the process and how the county reviews it, or goes through the process for approval, and all the pesticide reviews, as well as all of the approved prescriptions, are also available on this program page. So that's the first part of it. Is there any questions or comments that the commissioners have about the committee's recommendation or the components of our policy?
Not at this time.
Okay, yes. So looking at slide 3, and you said that the committee had concerns about this spike in usage. I think you and I went back and forth on some emails, because I had seen this trying to answer a citizen's question a few months ago, and I may misstate my memory on this. My memory is a little cloudy, but I thought that what I was told was that a big part of this spike was because the type of pesticide was changed that had like a lower concentration. But then on the right side, the left side of this graph, it says pounds of active ingredient. So that kind of counteracts what I thought I understood the explanation was. So now I'm back to being concerned again as to why we would have such a massive spike in use of active pesticide when you say we've got a policy that's trying to be least disruptive possible.
I remember now. I think it was a board conversation where you asked that question.
With the Lawrence Lake guys.
Yeah, yeah, and you were, I remember you asking, you know, what was the difference between the spike, and then it was like, oh, okay, well, it just was, okay. Sorry, just talking to myself.
Yeah, that's what the Lawrence Lake Committee explained. She's jogging my memory. That's what the Lawrence Lake Committee explained to me was the explanation, and I accepted it at the time because I didn't know any better. But that's not what this graph really seems to be saying. Can you illuminate that, Patrick?
Sure. So the best way to equalize or to perceive the differences in different types of pesticide is not just to report on the amount of gallons or pounds that are applied, but to use the active ingredient. So pounds of active ingredient within each product. So even if you use a concentrate and then dilute it with water versus buying a ready to use, or even if you get a pelletized version, each one will have a concentration of active ingredient. So these numbers are equalized by the active ingredient only. So it doesn't have any binder, doesn't have any water, doesn't have anything that isn't active ingredient, so that it's actually easier to see actual use and not just application numbers by volume. So in the past, so before 2017, we were using, and we still do use it, a pelletized version of an herbicide in the lakes that has, I believe, a 0.5% concentration, where now we're using a liquid herbicide that doesn't have any dilution. So it's just being put in as a concentrate, I guess, as you will, because the lake itself is the dilution portion.
And did the board's policy change, or did the advisory committee decide that it wasn't working? What was going on in 2016?
Basically, a new prescription was written and adopted. So once it was adopted, then it's been in use since 2017.
Okay, but the next slide says that the committee is concerned about, or you said, I think, that the committee is concerned about this spike. So, but aren't they the ones that approved the prescription?
Absolutely. Well, the board approves the prescription. The
recommends.
Yeah, they recommend the adoption of it because they were convinced that, this was, the department said this is a good way to go, and now they're doing it. And what they're saying is, if we just compare what's being done to the policy, it'll always be at odds. What we'd like to do is just know that the board approves of the lake management plan, and then they'll just report on that.
Why? So there's really two spikes here. I mean, 2020 is double what 2017, 2018, 2019. So what was going on in 2019? I don't remember this, if it happened. I was never asked, did I want to double the amount of pesticide active ingredient that was used for the previous 3 years, which was about 4 or 5 times as much as was used in the previous 3 years before that. So what was the evaluation in 2020 that led to such a massive additional spike over 2017 to 2019?
So there was, I believe 2017 was when one of the lakes got a new prescription. And then I believe the subsequent year there was then this, I believe the first prescription that was approved was just for Long Lake. And then the subsequent year there was a new one for Lake Lawrence. And then I believe what happened is they had good efficacy in 2017. So they didn't use as much in 2018 in Long Lake, but then they began in Lake Lawrence. So even though the graphs look the same, I believe it was actually 2 different lakes that did about the same thing, but in alternating years. And then I believe in 2020, both lakes got their full application. And I also know that Long Lake has not an invasive weed, curly pond weed, that requires a different set of control than the native weeds do. And so there was 2 applications for the 2 different species.
So how often does this get reviewed? I mean, if 5 of the 6 members of the committee have concerns, are they going to be making a new recommendation that's radically different to come to the board? And when will I see that?
Every year, the advisory committee is asked to review the annual report and report back to the county. So they just report back once a year to the board through me.
And so you're reporting that now?
That is correct.
And they're not necessarily, well, what are we supposed to take out of their, I mean, it's kind of vague. Concerns over use of herbicide use, concern over high hazard herbicide. Concern, okay, concern, but they're the ones that recommended it, then the board adopted it. So why am I seeing a concern and not a revised recommendation to make the change, to address the concern? I don't know anything about this stuff. I'm not an expert in this science. So I thought that's why we had the committee, is to try to parse through this and make the right recommendations to the Board of Health.
Well, the problem is that the committee members aren't necessarily lakes experts either. So they rely on the departments to communicate through their annual report on how effective they are being. And I think one of the issues is that the report doesn't report really well on how well they're doing. So one year you see a spike, but you don't know why. And then the next year's report doesn't tell you necessarily how well they did. And so that's why the committee doesn't know what to do. They would rather just be able to say they are following a plan just as it was approved. Because if they say that, if they compare it to the policy, they feel as though we're not really following the policy.
So one more question. That's a good segue to my next question, which is about this recommendation for a long-range management plan. So what does that mean? What's in that? How do we make one of those, if that's what the recommendation is? I don't know what one of those looks like and what we would have to do to fulfill their recommendation for this management plan.
Well, the county has developed long-range management plans in the past for Long Lake. They did one for Black Lake in the past. So it would be engaging with the Lakes program and see, and have them write down, what are their goals for overall pest management. If the policy says to emphasize permanent reductions, then what's their approach to, if it just keeps going up and down, what's the overall approach that they're taking to manage the pest problems that they have, be it native species or incoming invasive species?
Well, I'm like, water quality is critically important. And just like Commissioner Edwards was frustrated earlier about how long things take with respect to dealing with fecal coliform, I'm just as concerned about herbicide and high hazard. I mean, another one of my questions is, what kinds of stuff is, if there's concern over the use of high hazard herbicides, what is going on that justifies the use of something that would be classified as a high hazard herbicide? Do you think that's warranted?
I'm not a lakes expert, so honestly, I would rely more on a discussion with the lakes program staff to determine whether or not the use of the contact herbicides that they've switched to are getting them the efficacy that they want in compared to the lower hazard herbicides that were used in the past.
Okay. Commissioner Mejia.
So I have a recommendation, and then, but I'll just say this comment. I mean, I went down to Florida recently, and I found it interesting that at one of their lakes that they had kind of like this machine go in and dig up the weeds. I mean, has those options been revised here in Thurston County and
instead of pesticides? Instead
of pesticides and
mechanical removal.
the mechanical remover, yeah, it was a pretty interesting.
So they do some mechanical weed removal in certain portions of Long Lake, but it seems to be getting less and less each year because it's extremely expensive in comparison to herbicide use.
Now, this is Art, and that was the predominant way of managing Long Lake years ago. So this might be something, given the complexity of it and the time available, where if you'd like, we could come back and have a broader discussion about the policy and in the pesticide review process and all that, because it is pretty complex, and it's challenging issues for the county departments to try to manage and work with stakeholders and others to come up with a plan that kind of meets their goals and meets their budgets and all that.
I have a recommendation. I don't know. Sorry, I was going to say that, but I would like to invite the Pest and Vegetation Management Committee members to come here and you know, they obviously have concerns, and I feel like we should hear them out and get to talk to them about this. I'm not sure if anyone else would be in agreement with that.
Yeah, that's what I'm pushing for.
Go ahead, Commissioner. What, if you something?
And I guess just from a historical perspective, I've been around a long time dealing with this. And the reason the lakes can't use the mechanical harvester is because they don't have enough money. I mean, they do tax themselves a lot. All of these lake organizations are working on water quality. My big push is our lakes are, you know, kind of our hidden diamonds, if you will, and they're a real asset to the whole community, not just people that live on the lakes. And I think we should be helping them solve these problems. And then we wouldn't have to maybe use the chemical application as much if we were able to use the mechanical harvesters. I mean, it was all the way back in the 80s. I offered some of our property at the time to put the spoils and dredge the lake out. Because the reason those lakes are so bad, first of all, they're lowland lakes, and then they were used for sawmills and all that type of activity. And so there are ways we could do this, but you're gonna kill a frog or something in the process if you know, and you have to be willing to have a trade-off, if you will. And I just think that it's our responsibility to do these lakes, not just the lake people, because they pay a lot of extra taxes just to live there. But they also form these districts or are taxed heavier in different ways. And they're expected to do it themselves. And our lakes are getting kind of pukey because of it. I mean, Black Lake has a pretty good response to their investment of $1 million something. But I think we should be doing that. Not doing the whole thing, but participating. Right now, I'll just use Lawrence Lake as an example because I know more about that. Currently, about half of all the money they raise goes to administrative overhead instead of solving problems. And I know the other lake management processes that were explored by those lakes, they didn't want to get into it because of the expense and the fact that the county made it cost more for them. They didn't get a very good deal with the county. I don't know, it's kind of like the veterans thing. I hope none of that stuff is 100% accurate, but if the veterans are only getting 10% out of what we're raising, I don't think we're doing the right thing. If the lakes people are only getting 50% out of what we're doing, and we have to do all these other things, chemicals and whatnot, I don't think it's a good public policy. I mean, we're stretched here with the budget that we need to come up with solutions for. Somehow or another, we need to prioritize better, work with others. I mean, just like right now, we've got a group in here wanting us to do something to help them solve a problem they've invested a lot of money into. And we're telling them, well, yep, we're going to get to it when we can through the bureaucratic process.
I've been pushing action on septic systems for the whole time I've been on the commission. I've gotten no support from any of my seatmates at any point. I will continue to push for action on septic systems. That is exactly what the citizen came here asking for action on. And we're going to get there eventually. But, you know, it's not, you can't just blame a homeless camp that you don't even know exists.
Well, I realize that.
On the water quality problems that they believe is coming from septics.
But we actually,
I'll find a way. If you can come, if anybody can come up with a way to say, step A will increase water quality, I will find a way to fund step A. I believe what John Pettit said is true. Water quality is fundamental to human health. It's fundamental to our quality of life. It should be treated as an emergency. It should be treated like COVID-19, frankly. It makes me ill when we had to close beaches in the height of summer in this county because we can't find a way to properly manage our water quality. And I don't think there's any expense that I wouldn't vote to fund, but it's a very complicated problem, and I don't get a lot of clear answers sometimes. I feel like I get run around in circles. I've been working, you know, just the septic's a good example. That's only one example. Lake management's another example. you know, again, I have to rely on the expertise of my staff and scientists. If people will put together a plan and say this, Commissioner Menser, will improve water quality, I will find a way to fund that plan, period.
Okay.
Whether I have to raise taxes, whether I have to unfund some other piece of county government, I'll do it.
Okay. Next.
Return.
Okay. I guess I want to take this opportunity to point out that I've been through this. That's one of the benefits of getting old. I've been through it. The county was saying that, hey, these septics are bad. This, I'm referring to Lawrence Lake. You got to do something. You know, we need to move everybody away from the lake. We need to redo everybody's septic. We need to create a sewer system on the lakes. That was what the proposal was initially. And we said, well, wait a minute. We don't think that's it. We live on the lake. We want the water to be pristine as can possibly be. And so we hired, like Black Lake did, we hired our own engineering firm and went out and spent that same amount of money, had the whole lake analyzed, and they did the dye testing and everything. It was not septic systems. It was lawn fertilizer, and it was nutrients in the lake from prior activities. And when you have this continual weed growth and in decomposition, you're just compounding the problem every year. But it was not septics. Now, when they did Black Lake, it's my understanding from that report, they didn't find that septics all around the lake were the problem, but somewhere back up here, there is a problem. And maybe it's septics, I don't know. But the information that we went through from 2016 on, this is when I really, I got involved in it back in the 80s too, but in 2014, 15, and 16, it was a big push to, on the whole septic system. Septics are bad. Septics don't create near the problem that lot creates when they have a blowout. They have minor problems with septic systems. Everybody I know of takes care of their septic system. And the information that we receive is more about forcing the population into the urban core and making it uncomfortable to live in rural America, just like I asked the other day about pressure systems versus gravity systems. Gravity systems cost about $6,000. Pressure systems cost about $15,000. Your more complicated systems can be $30,000. But gravity is the best way to go. Gravity works all the time. And Mother Nature has time to work it when it's done right. But that's not conducive to the philosophy of forcing the population to live in the urban core, because it doesn't add to the expense. That's what's going on here. There's a certain segment of our society that is wanting to push the population out of rural America into the urban core. And they're using whatever means they can do. Some of it is misinformation.
Well,
that's what we're faced with.
I mean, to say that everyone you know maintains their septic, Art presented the statistics. It's pretty, it's like 33% or whatever it is, 30.
Oh, you mean maintain according to the law to have it inspected?
Yeah.
Well, they don't believe in the law. That's the problem.
Okay, well, that is a problem.
Well, it might be a problem if there was a problem. It was all implemented.
Art and Kevin have shown.
I don't believe them for a second that all that is the way they put it. They have a personal agenda that they are trying to push the citizens in this county and all around the country to live in the urban core.
Law, Growth Management Act. That is the law.
I know that. I know that. But just because something happens, so's the speed limit. When they make the speed limit 50 to save gas and nobody abides by it, it doesn't do anything to help the problem because they're all going 60 or trying to get away with things. We should have laws that the public respects and has an understanding that there's something there.
I've been ticketed for speeding many, many times, probably double digits, and I watch my speed when I drive around Thurston County. We're getting off topic. So.
Okay.
Yeah, we are. But I would ask, the commissioners to defer from saying that staff have an agenda, especially when they're doing us a service and providing information over here. And I was a staff member of the county once before, and I did all my work in service of the county, and I was a public servant, and I feel we should respect staff and not say that they have an agenda when they get up here and give us information. And so I wish we could get back on the topic. I think I had made a recommendation and want to see if we can.
So the recommendation is for a board
move.
briefing with the PIVMAC.
Yes.
And we all agreed on that.
What's that?
Have a briefing with the Citizen Advisory Committee.
Certainly, I think we should have those folks in. Those are the people that are impacted with everything that we do here. And when we try to impose something.
Hold on, Commissioner Mejia, I interrupted her and I don't.
No.
You weren't done.
I was done.
Okay, sorry about that. Go ahead, sorry. Just trying to make sure we're respectful here.
Sure.
Go for it.
When we, as a government, impose something on the citizens that they don't believe, that is a recipe for failure. And I just think we should base everything on all of the truth, not just the truth that matches your agenda. I know nobody wants to think about some people have an agenda, but it's just the reality of life. My agenda is to do everything right. That's all I'm asking. I want everything done right. I want it to be truthful, based on facts, not on some facts. And if you would have been in those meetings back in 16 when the county was trying to do this, and they were giving out information that turned out not to be correct information. I've mentioned, I've got a letter from the county manager. He responded to a citizen about it that ended up in, oh, well, it really wasn't 14%. It was, well, I mean, half of a percent.
How about the city of Lacey spending millions and millions of dollars because they're trying to protect their well because the concentration of septics around Capitol Golf Course were polluting their municipal water source to the point where they went ahead and subsidized the imposition of sewer system out there. Yeah. They didn't do that because
I can't speak to that because I don't know.
Well,
I really don't know that. I'm hoping they're doing the right thing. I really do. And I don't want to see our citizens.
And we've had presentations about how when you have I'm not saying that aseptic causes, but the greater the concentration, as we see around, was it Tanglewild, where we have the great concentration, and you see the aquifer, the testing of the aquifer, and the loading and the modeling that was done by a hydrologist to show that there's only a certain capacity of septic concentrations that can be handled before you start to exceed state and federal water quality standards.
That's possible.
We're not quite past the line yet, but it's getting there.
We're not even close. That's the problem. The state sets a boundary at a certain level, and then our staff has said, well, let's not go there. Let's keep it down here.
Well, that's to keep an early warning. That's to keep an eye.
Okay, their intentions could be good, but the problem is you take a development down by Scatter Creek, and they have now got houses on 1 acre or whatever that development is down there. It was a dairy farm before that, and the nitrate levels were way high when it was a dairy farm. Now, there's something like 100 septic tanks down there. And that's a very shallow aquifer. It only goes down about 100 feet, the whole thing. The Lacey one has about 3 aquifers that goes down about 400 feet. So there's different strata. Stuff doesn't even get to, as it works its way out. But when you take a development that used to be a big problem with nitrates, now it's saturated with septic systems, and it's less. It's less because the stuff is treated properly. And that isn't always done because the government says pump it every 3 years. Pumping it every 3 years is detrimental to the little bugs in there that are eating things up. They need to have a period of time to make it work. But it's not conducive to forcing the population. I know nobody wants to hear about how the population is being encouraged to move to the urban core, but it is true.
Commissioners,
it's true. I'm never
Commissioners,
arguing with that.
I'm sorry. Can we please get back on? It's 5:25.
State law.
And can we please get back on topic?
Let's go to noxious weed control prescriptions, Patrick.
Just to circle back, and I'm sorry, my microphone's off. To circle back on this great conversation. So I will coordinate with the staff, having the committee members to come and have, from their personal perspective, what their concerns are related to the application of pesticides.
Okay,
we'll coordinate that.
Let's wrap that up and move on to the next topic, which is item 7 on the agenda, noxious weed prescriptions.
Okay, I feel like I should reintroduce myself, but I'll just keep going. So the second component of the advisory committee's role is to review new prescriptions when they come in. And so our noxious weed control program has written or drafted 3 prescriptions for the control of garlic mustard, hanging sedge. It looks like I put garlic mustard on there twice. And let me look up the other one real quick. And they've and thistles. And so they've reviewed these prescriptions. They've worked with the department to adjust the language a little bit to better incorporate the policy and to define the injury level a little bit better for when manual controls will be used and when chemical controls will be used. And so the process is the department writes the prescription, the committee reviews it, I review the chemical hazards associated with the pesticides. All of that gets presented to the committee, and then they make a recommendation to the Board of Health to either approve or reject the prescriptions. All of these 3 prescriptions have been reviewed, and they recommend the adoption of all 3 of them. Next slide. So the garlic mustard, I'm sorry, I put in there twice. It's supposed to be thistle.
Thistle.
So 2 of them are class A noxious weeds that are required or mandatory control in our state and in our county. And the other one is being preemptive in the sense that we know that it's near our area, but it hasn't been in Thurston County yet and listed for control. So this would allow them to be able to take action as soon as possible when it is identified in our county. So they're just requesting that, or they're recommending that the board adopt all 3 of those prescriptions. That would be the request from the departments, and then also approved by the committee, or recommended, I should say, for adoption by the committee.
I have a question.
Yep.
What's the difference between moderate hazard and high hazard? What does that mean?
So if you can go back a slide or 2, so triclopyr is a chemical compound that if you broadcast applicate as opposed to spot spray, so like if it's in a weed is in your, like a dandelion is in your yard, instead of spraying your entire lawn with a chemical that will control all dandelions, if you instead chose a product that you just spray on that one particular plant, that's the difference between the moderate hazard versus high hazard for triclopyr. So when you broadcast applicate triclopyr over a whole bunch of vegetation, it's high in hazard because of the potential exposures to birds and small animals that would eat the fruit or anything else that they would eat on those plants. But if you just spot spray individual plants, then the amount that is expected to be eaten by a small animal or bird is much less. And so therefore it still is of concern, but it's not considered high hazard in the sense that the dose that they would expect to get would be less than what the EPA has calculated would cause harm.
What about high hazard?
High hazard for like glyphosate. Glyphosate is in Roundup products. That has the International Agency on the Research for Cancer considers it a probable human carcinogen, even though the EPA considers it not a human carcinogen. So that high hazard is to denote that we have found information that identifies a hazard potential with that chemical that the policy says is unacceptable.
And so why is it in here? Is there no alternative whatsoever to deal with these to particular ones. Glyphosate is the thing I keep hearing from citizens is the worst thing possible to be putting into our atmosphere.
There's a lot of concern from the public about exposures to glyphosate products because they're used so widely in our food items as well as in residential communities. Glyphosate is often put into some of our noxious weed prescriptions because some of the other alternatives like imazapyr or aminopyrrolid can't be used in a residential setting according to the label. And so we ensure that we have a chemical that will work for the public in a residential setting that they can actually purchase.
So I'm just going to get some clarification. So a possible human carcinogen can be put in a residential area?
These aren't products that we register. They're registered by the EPA and the Washington State Department of Agriculture. So what we're doing in Thurston County is our policy states hazards that are considered unacceptable according to the policy, and carcinogenicity potential is one of those. So whenever there's a chemical proposed to use and environmental health evaluates it and sees that it's a carcinogen or potential carcinogen, it's our role to inform the committee, the departments, and the Board of Health that what's being proposed to use has that hazard.
Patrick, I think one of the questions is, when the noxious weed folks look at this, do they look for other alternatives that would be effective? And is part of the reason they're selecting glyphosate is because even though it is a high hazard product, it is effective, whereas there aren't many other alternatives that are available?
That's right, and the alternatives may not be able to be used in a residential setting. So what a commercial applicator can use, and like our department staff can use as licensed applicators, is different than what a homeowner can go into, say, a Lowe's or Home Depot and purchase and apply in their own yard. So glyphosate is one that a homeowner can apply themselves and can be used in a residential setting, where some of the other ones, alternatives that might be equally as effective, can only be used by licensed applicators. So that's why sometimes our noxious weed control prescriptions will list two different chemicals depending on where they find those noxious weeds.
County manager has a question.
Hey, Patrick, this is Romero. Forgive me, my memory is playing a game with me, but I recall back in either 2014 or maybe 15, the Board of Health eliminated the use of glyphosate on most of the prescriptions the county uses. So, and I don't know when the Board of Health in 2017 reinstated the glyphosate usage. So I'm a little bit on a gap on that, and please correct me if my memory served me wrong in here.
Sure. So what happened is that determination by the International Agency on the Research for Cancer, IARC is what they get commonly referred to as, when that determination came out, which I believe was 2013, what the county decided to do is, because it went from a low hazard chemical to a high hazard chemical, was to review every single prescription that the county had with glyphosate in it and actively look for replacement chemicals. And each one of those, I want to say there was over 25 that reviewed, evaluated, and approximately 8 or 10 of the noxious weed control prescriptions didn't have an effective substitute. So they were brought forth to get approved again as if they were new prescriptions, but all of the other ones had alternative chemicals replaced whenever possible. So we do still have some prescriptions, but they were evaluated, and when there was an effective chemical of lesser hazard to replace it with, it was done.
So in this particular proposal, there is no other option, as I hear, other than using glyphosate in some instances.
Correct.
And even a manual removal doesn't work.
Well, the manual removal is written into the prescription, so I believe that like for one of the prescriptions, that if there's approximately 20 plants or less, they will be manually controlled and dug out and removed. But then once that effort level gets too great, then they will propose to use chemicals. So it'll be in a staff evaluation, location by location, depending on the type of plant, the density, how many, and how much effort it takes to get rid of them.
Commissioner Edwards.
I guess when it comes to manual removal, I can say out at my place, I've got a weed puller deal. It'll pull Scotch broom, it'll pull tansy, ragwort, or dandelions. But it's that amount of work that it takes. I mean, if you go out on the edges of my lawn or my area, you know, where my pasture is or something, you'll find dandelions and stuff, but you won't find any Scotch broom or tansy because you just have to stay on top of it and you pull it. That's the best, but trying to get people to do that is almost impossible. So what Patrick is saying is in certain things, they had to allow something that would work in a very minimal quantity, but that's the way they got to do it, or it just doesn't get the job done. And that's one of these things where if you're a organic farmer, for an example, you can't use that stuff because you can't get that designation. So you have to put in that extra manual labor, if you will, to get the job done. Well, on the other hand, then you have to charge more for that particular product because you're doing it more environmentally sensitive. Some things we can get away with and some we can't, but I think Thurston County has done a great job on cutting back where they can. One of the big things that came up about that same time frame that Patrick is talking about it was roadside maintenance, where we had guards. We couldn't use the mowers to really do it right, so you know, some of that product, I guess, was used. But we made determinations about make sure we don't spray it when there's bees out, for an example, or certain times of the year or the day, or don't do it in the evening, but you know, do it in the morning or something like that. I don't know. He's got it all figured out, I'm sure, but I think we're doing an excellent job trying to use the less toxicity that we can possibly use. And it goes back to my same thing about lakes. They can't do it on their own. They've bonded themselves out, but it just can't be kept going that way. Not if we're going to really make our lakes the pristine jewels that they could be. So we're going to have to invest.
And I just pulled up one of the prescriptions that Patrick referenced, and it shows that, you know, there's recommendations for manual techniques and biological techniques. So that it is included there. So it isn't just jump to pesticides use, but they do have thresholds and things for when it's appropriate to consider something alternative to mechanical controls. So, and that shows up in all three of them.
Is there a distinction here between, this is where I get kind of confused sometimes, between what plants that are in the water versus plants that are aquatic plants? I don't know what the terminology is, because obviously it seems like it could be much more targeted if you weren't dealing with water. And then seems like it gets really dangerous when you have to start applying this stuff in water.
Well, I think the big issue with aquatic plant management is, are you going after invasive species before they've taken over, or are you going, or have they already taken over? I know our Lakes group has spent a great deal of time doing manual control efforts until the problem just gets too big. So I know that I believe there was a prescription adopted last year for Blue Lake because they had been controlling a milfoil species for years manually, and then it just one year it got bigger than what could be controlled by hand. And so they did their first application last year in Blue Lake to control a noxious weed. So, and I know that they do that in the Chehalis River as well. So there are species that when the populations are low enough, they definitely get in that water with divers and hand pull to the best of their ability until the problem becomes too big. And like you stated, it's hard to be selective in an aquatic setting because you really can't spot applicate. The only selectivity you can do is based on the types of herbicides and the application season in which you apply it.
So do we have situations where glyphosate is permitted on a targeted land plant, but it's not permitted, you know, on an aquatic plant because you can't control it?
The only plants that glyphosate can control in an aquatic setting are ones that come out of the surface of the water, like a lily pad would, or that are on the side of the water that would be emergent, like maybe yellow flag iris, something like that. So it wouldn't be a submerged plant. You could not use glyphosate products on a submerged plant because it just it doesn't work.
Well, we heard like last year when we did the Black Lake, it was kind of confusing when we were doing the alum deal for Black Lake folks. They were simultaneously doing their plant management, and people were getting postcards and thinking that that's what we were approving, and then they were coming to us all upset because we were approving glyphosate, but it was a totally different. It was apples and oranges, but. So I know it's used near Black and around Black Lake. Even I guess those are plants sticking up out of the water, is what you're saying.
Right. So like a lily pad, you can spray the top of a lily pad with a glyphosate product, and it's systemic, so it'll circulate all the way through down to the root system and kill the entire plant. And that's why glyphosate is effective. It's systemic. It's not a contact herbicide that would just burn down the top and then leave the root system still alive. It will kill the entire plant.
Okay, well, we're out of time. I guess, what is the next step that is needed from the board?
There is a motion for your consideration.
So the recommendation from the Pest and Vegetation Management Advisory Committee would be to the board to recommend adopting all 3 of these noxious weed prescriptions.
I know the vice chair usually makes the motion, but I don't have any problem making the motion because I think they're doing the right thing. So if
I mean, I'm personally not ready to vote in favor of that. There's a lot of information here, and I'm going to do a little more reading on it. So somebody can make a motion, but that's fine. I won't be seconding it at this juncture. So
I need more information. The glyphosate is, I have like concerns about it, and I would like to know more information too. I don't mind moving this, I don't know if, you know, to another BoH meeting, but I need to know more.
Maybe we can combine the briefing from the members of the Pest Management Committee. Maybe the first part of that briefing will be just to give the board their perspective, and then we follow up on staff additional information related to the prescriptions that you heard today. Will that work?
I guess then could we follow up on what Commissioner Mejia said, bring in some of those lakes people so they can participate with us, because we're going to make a decision that's going to affect them. So why not let's get their input too? They're the ones that are directly affected, and hear what they've got to say about it.
Well, I thought it was the Pest Management Committee, the Commissioner Mejia suggested to come and provide their perspective related to their concerns.
Well, I'm not against that, but I'm trying to get it all done. I'm trying to get through the bureaucratic process, get everybody in. Let's hear about it. Then we could maybe make a decision, that's all.
Robin.
Thank you, Amy. I'm just curious if there's a timing concern by staff because of the need for treatment this summer?
I don't know that any of these 3 prescriptions need to be in place this summer.
I think they're already being used, and we're getting ready for next year.
Okay, fair enough. We'll just revisit this in a fairly reasonable period of time after, and I'll do some homework myself, and I'm sure Commissioner Mejia will as well. Okay, thank you guys.
Good job.
Let's go on to item 8, Board of Health members, health-related activities and accomplishments. Anything to report? Commissioner Edwards?
Well, I've kind of got on my tirade already about, the vaccinations. I would really like to see somehow, I don't know how we can do that individually, but in the new information that we received today from our discussion this morning, several of these, like chickenpox. Okay, you need to have vaccination or a healthcare provider verified the child had the disease. There are many different viruses that is sufficient. Right now, there is no benefit for any citizen. I think we've had about 12,000 of them now in Thurston County that have come down with this virus in one category or another. That's the ones we know about. I know there were thousands of other people that were sick in that early stages that said they were sicker than they've ever been in their life, but yet we don't seem to care. I think as part of our focus towards overall health for the community, we should come up with something that tests folks that want to be tested so that we can show, hey, you've already had it, you don't need the shot. We're not trusting Mother Nature in the least unless it's on one of the lists here of one of the vaccinations. For some reason, this seems to be, to me, about big pharma making big money. And if you've contracted this virus and you've recovered from it, I think that ought to be good enough if science would say that. But they don't want to say that because it's big money driving the show. Several articles that I've read, the pharmaceutical people have a hold of the physicians. That happened with me. I've got 2 veterinarians in my family. I can tell you they get free trips to here and there and conferences and this and that. All they got to do is use this product. Use this product and this product, and you get all the freebies you want. Pharmaceuticals have a stranglehold on this country. And I think that we should not disregard the benefits that Mother Nature gives us through the process of immunization. I don't think you ought to have inoculation if you had it and recovered. I still believe we're all going to get this, and we better start taking care of ourselves so we can survive it when we get it. And if you've got any kind of a underlying condition, you better start dealing with it because it's coming. So I know nobody wants to hear that, but I always say things nobody wants to hear. So anyway, that's my tirade again. That's my report.
Commissioner Mejia.
Well, my report, I've just been getting a lot of questions in regards to masking, about the governor's mandate yesterday, and just trying to put out information on my Facebook and my newsletter about the vaccines, and just trying to get the information out there. So that's basically it.
The board will be taking up that topic on Friday, is my understanding. The only thing I forgot to report on the immunization was I got my Tdap booster this summer.
What's a what?
It's Tdap. It's one of those immunizations that you're supposed to get every so often, a non-COVID related.
For a multitude of things?
It's pertussis and.
Oh, okay, for pneumonia and different things like that. Okay.
Yeah, it's like 3 or 4 things in one.
I'm good, you're staying healthy.
But yeah, I mean, it's just, let's not forget our regular, that was kind of Shelley's whole thing, is like there's other vaccinations we need folks keeping up on, even though we're really focused on COVID. Anyway, let's go to our health officer's report. Dr. Abdulmalik, thank you for sitting through all of that stuff, keeping you late, but why don't you let us know how you're doing and what's going on?
Thank you, commissioners. Good evening. I did want to reiterate that we are in the middle of our 5th wave of COVID-19, both here in Thurston County, and we're echoing this wave that's being felt across the state and across the country. Case counts are rising and our test positivity rate is the highest it's ever been. So we're currently at 246 cases per 100,000 over the past 14 days. And our test positivity rate is 11.8%. This means that there's likely a lot more COVID-19 circulating in our community than is being tested. We are seeing breakthrough cases, and we anticipate that going forward, we may expect to see more breakthrough cases. The vaccine is still performing well, and it is protecting people from severe illness, hospitalizations, and death. So we are continuing to watch that situation really carefully. What we have found is that even folks who are fully vaccinated are capable of spreading COVID-19, specifically the Delta variant, if they become infected. So at this time, I'm recommending that everyone, even if you've been fully vaccinated, wear masks in indoor public spaces where vaccination status hasn't been confirmed. I did want to take a moment and share some of the latest data that the CDC has shared with us regarding reinfection rates after COVID-19 infection. So the CDC within the last week has released a study that showed where they looked at folks who had already gotten COVID-19. And we do see some reinfections. They are rare, but not impossible in the first 90 days. So there's a lot of work that's done, in terms of sequencing of samples and a lot of different things when somebody tests positive within that 90-day window to try to answer those questions. That is fairly rare at this point. But when you look beyond that, what this study looked at is how likely was it for folks to get infected with COVID-19 again, and did getting a vaccine, one of the 3 approved vaccines, make a difference? And what they found in this study was that folks who had been vaccinated after having natural infection were 2.3 times less likely to get reinfected than folks that hadn't been vaccinated after their first infection. So this shows that the vaccine definitely provides a significant protective advantage over natural infection in terms of protecting folks from getting COVID-19 again. We are still learning more about how previous infection affects disease severity. There are a number of variants, and there's a lot that we're learning on this issue, but I did want to share that latest piece of CDC research with you. I also wanted to take the opportunity to move a little bit further afield from COVID-19, and I just wanted to talk about some of the other things that we've been doing as a department. So looking at other communicable diseases, in the past month, we've followed up 96 cases of a diverse spectrum of diseases, including Campylobacter, botulism, Giardia, Legionella, Salmonella, and syphilis, amongst many others. And we're continuing to work with and manage direct observed therapy for multiple tuberculosis patients in our county and help assist identifying folks who might have active TB. I wanted to take a few more minutes and just talk about the excessive heat warning. So there is a lot of heat headed our way, starting from about noon Wednesday to 7 p.m. Saturday, and temperatures are projected to rise into the high 90s and near 100 degrees in Thurston County. Just want to make sure to remind everyone to wear light colored, loose fitting clothing, try to stay in an air conditioned space where possible, and stay indoors in a cool space, particularly during the heat of the day. I would like to just recommend hydration. And if you know folks that are at high risk of significant outcomes, so folks that might have medical comorbidities or medications that they're on, folks that are over age 65, as well as infants and children, just make sure that you check on them periodically to make sure that they're doing okay. Heat stroke, which is severe heat-related illness, is an emergency. And if you see somebody who is having heat stroke, please call 911. If you find yourself getting overheated, take a moment, stop, find some shade, drink some fluids, and do your best to cool down. And with that, I am open to any questions you may have. Thank you so much.
Commissioner Edwards.
On the breakthrough cases, are you finding that people get reinfected that have poor resistance, underlying conditions maybe, versus a very healthy person that maybe had it or was vaccinated, and they're less likely to get it? Are you finding any of that? Or you keep trying to keep track of how we're doing as a society? You know, so if you got a big problem, you're more likely to get it. I really believe this is going to be like the common cold. It's coming. And the common cold changes regularly, as does the flu. You know, it figures out a way, but we don't seem to be so drastically affected, you know, on each one of those variances that take place. So how does that work out for those folks that have been vaccinated or have had it and they get it again? Are they getting it because their just immune system is so down, they're tired, they need to take a vitamin C? What do they need to do? What'll work? What'll help?
So that's a little bit of a tricky question because the information is thought about through multiple different lenses. So as far as the population that I was talking about that the CDC released, I don't know off the top of my head what those factors may have been. I do know that looking across the board, what we're finding overall is that folks that are at the highest, that are at the most significant risk for infection post-vaccination are often folks who are immune suppressed, whose immune system didn't get the opportunity to mount a vigorous response to vaccine, or for folks whose antibody immunity and other immunity waned over time. So that's a lot of where that first focus is. We're still learning more about other factors that might play a role in waning immunity.
Okay, you just don't know, basically, right?
So we do know that things that affect reinfection often have to do with how well somebody's immune system is functioning. And so those are the folks that are the highest risk. So when you're looking at countries that are implementing booster shots, those are the highest priority folks for getting booster shots in a number of cases. In terms of the rest of it, you're absolutely right. We are still learning.
Thank you.
Questions for Dr. Hay? No? Okay, thank you. Let's go to the director's report. Shelley?
Thank you so much. Good evening, commissioners. I really enjoyed the passionate and engaged discussion tonight on the various Board of Health topics. And I also want to say thank you so much to all of our presenters and staff and speakers and citizens that take the time to come to the meetings, as well as send us email messages. We take that very seriously. And our staff work very hard to use the best available data and bring you science-based information to help make decisions in the best interest of public health and to protect our environment. So we greatly appreciate your support, especially as we are on day 552 of our COVID-19 emergency response, which not only affects our frontline COVID response workers, but also all of our staff that work in all areas and healthcare workers. And to that end, there was a national and state alert that we sent out to all healthcare providers as well as public health workers this last week to share about the impacts on health and well-being of our workforce due to the traumatic events of this pandemic. And our department, as well as departments around the country, had the opportunity to participate in a national survey with the CDC, and it showed over 50% of frontline healthcare workers and public health workers are suffering from depression, anxiety, risky alcohol use, PTSD, and suicidal ideation. And the drivers tend to be burnout, workload, as well as job-related stress and criticisms. So supporting our workers is incredibly important. We feel very supported. We greatly appreciate it. One of the protective factors against all of these negative things impacting our workforce is the support of leadership. And there are a lot of resources out there to support those healthcare workers and public health staff that are suffering from some of these things. And I shared that recently with our staff at a staff meeting, and we shared that in our public health alert that we send out widely to all healthcare providers. Following up on the data that Dr. Abdelmalik just shared with you, as well as our information that we shared this morning, I was able to follow up and look at our hospital data as of this afternoon. And not only did we add 50 new cases to our Thurston County investigators caseload today, but there are currently 39 inpatient people with COVID in our Thurston County local hospitals, and 21 of those are on ventilators. So this is extremely serious. Just want to drive home the importance of getting vaccinated. We have vaccine available 7 days a week. This is the best way that you can protect yourself if you have not got vaccinated yet. Please wear a mask. And as we are ending towards the summer here, please gather and socialize responsibly to protect others in our community. And I did have some other items from our department, but I'm gonna defer that to our next Board of Health meeting in the interest of time today. Thank you so much.
Yeah.
I was
Well, before
very
that,
anxious about this.
9 o'clock or whatever. Oh, yeah, that's right. Shelley, can you hear me now?
Yes, sir.
Mine just.
Did you say there was 21 on ventilators? Are all
COVID
21
patient.
are those 21 people in our hospital from Thurston County or
I do
from
not.
region, the whole region?
I do not have the county of residence of those who are hospitalized
Okay.
in Thurston County.
I guess what I'm getting at there is we divulge information to the community. I like to make sure we tell them the straight up truth all the time. And if, you know, if that's a 5-county area, I think you ought to say so. Just for the sake of truthfulness. I would guess probably maybe 10 of them are Thurston County. I don't know the answer to that, but I think it's crucial that we're always straight up with the public. So.
The hospital's full, though. It's gonna,
well,
it's full for them if they need to go there.
You probably don't want me to get going on the hospital thing. We shut down the whole hospital economy about a year and a half ago or something. And we had all kinds of elective surgeries and whatnot were canceled. They built hospitals in different places. None of them were used. So we tend to overreact. And that's what I'm trying to get away from. I don't want to overreact. We do have problems and we need people in hospitals. A lot of the folks that are taking their young people in, I can't imagine being a parent now and having your kid come down sick. You're going to think the worst and you're going to treat it as if it is the worst and you're going to get it dealt with. And so maybe they don't need to be in the hospital, but they're going to be in the hospital, especially if we cut out elective surgery again. They're going to need to keep functioning. So anyway, just kind of a editorial, I guess. Like to keep all the information straight for everybody that might be listening. Thank you. I'll let it go at that for now.
We're adjourned. Thank you.
Thank you.